Then this question says, what should I do if I cannot contact my original surgeon following surgery and I have concerns? Well, again, sadly, I do hear this a lot, and it goes back to the thing I did about BARPs. BARPs asked me to say, what's the importance of having a BARP surgeon? And if you go with a reputable surgeon with a reputable clinic sort of outfit, you will have somewhere to go if the surgeon has moved or dies or goes on holiday or retires or whatever. You know, you will be able to go to the clinic or the BARPs or whatever to say, look, I can't get a hold of my surgeon. Can you help me? And they, if that surgeon is a member of a registered body like that, then they will be able to say, hold on a minute, this is a patient of yours you need to be looking after, because we have a duty to patients to look after them. If your surgeon is not a member of any of these sorts of organizations, and if the clinic is not a sort of reputable clinic, because if you can't get hold of the surgeon, I mean, often the surgeon, it will be like the clinic or the clinic nurse or what have you. So you often, you know, you may not have a direct link with the surgeon. I mean, it's quite rare to have a link with a surgeon like this. You know, you got the link with the main guy here. You know, you don't realize how, you know, rare that is. Direct link with the guy. He's here. That's him. That's him. But it's rare. Yeah, it is rare to have a link direct with the surgeon. So it's not unusual to not have a direct link with the surgeon, but you should have a link with the clinic who can then talk to the surgeon and get back to you, and then, you know, arrange for you to be able to see him and what have you. So it's really, if you kind of can't get hold of the surgeon, then you should go to the clinic or the facility where you had the surgery and say, look, what's going on, because it's sort of up to the clinic really to look after you if the individual surgeon's not doing that, particularly if the surgeon just kind of works for a clinic, because the surgeon might move on. But most of us want to kind of look after our patients, and I think most surgeons are quite keen to look after people, but I do hear stories of people not being able to get hold of their surgeons. But yeah, so what should you do? You should go to the clinic. And then if you can't get hold of them at the clinic, or if there's a problem with the clinic, then you should talk to well, ideally prior to surgery, look what registered bodies are there, members of BARPs, BAPRAS, things like that. See what bodies they're members of, because there will be a code of conduct. We have a code of conduct that we are expected to work within in those organizations. So that gives you another layer of accountability or recourse if you have any questions or anything you want to bring up and you can't get directly access to